right. I am live. It's 3 o'clock Pacific Standard Time. I'm in Westlake Village, California, and I'm waiting for my friends to join. Hi, Paula? Paula? Hopefully that's right. Hi there. Hi, Yvonne. And hi, Martina. I'm just waiting for my friend Dr. Phil Robb to join us. Hi, Kermie and Susan. Hi, everyone who's just joined. Thanks for joining. I am just waiting for Dr. Philip Robb to join in, and he is my guest today. We're chatting about all things coronavirus. Hi there he is. Here you go. Yes. All right. Hi, Travel Blues. Thank you for sending your comments in earlier. Hi, Dr. Kuhano. Sorry. Hopefully I said that correctly. And I'm waiting. So Travel Blues, thank you for sending your comment. I'm going to post your comment later. Hi there.
Hey.
All right. So my friend Phil Robb, Jr., should I say? Sorry. I like to say Dr. Robb.
It's
easier
easy
to say that. So my friend Dr. Robb is in Atlanta, Georgia, or outside of Atlanta, Georgia. Do you want to go ahead and introduce yourself?
Sure. So I'm Philip Robb Jr. Out of Atlanta, Georgia, and I do facial plastic surgery. And I'm about 30 minutes north of the city, in a suburb called Alpharetta. How's the audio, Christina?
Pretty good. I mean, I know it's kind of low. I know you're thinking that it's low, right?
Yeah, and I hear like a little echo, so I'm just trying to. Do you hear the echo, or is that only me?
I think it's just yours. I don't hear an echo on my side.
All right, sweet. So yeah, my practice is generally aging face and rhinoplasty, and with some
Oh,
skin
Mother
cancer
Healing says it's
reconstruction.
echoing a little bit.
All right, let's try to fix
Am
that.
I
Should I just?
echoing? I hope I'm not echoing.
You are so not echoey.
Oh, good.
It's only me.
Hi, Danny.
Let's see here. Hey, babe.
It
Is
might be,
that better?
I can't hear you too well anyways. Like on my side, it's low, so.
Okay. Travel Blues can also hear the echo. Well, here, let me try something. Try the audio this way.
Okay.
Is this better?
Nice.
Is this better?
That's looking good.
Echo 19, Echo 19. We're going to take off on a runway here in a minute.
We're going to go on a flight today.
Is the audio better, team?
Jupiter and Filler is joined. Wow, nice. Okay, great.
Mother Healing
great.
says yes, much better. Okay. I'll
All
rock
right.
the headphones.
So you were mentioning about your practice.
Yeah, so aging face, rhinoplasty, kind of the classic facial plastic surgery practice. I'm in private practice by myself, and did the classic route through head and neck surgery, and then a fellowship in plastic and reconstructive surgery. And then I've been in my own practice now for about 3.5 years. And
great.
Before coronavirus, it was great.
I know. It was great for both of us, right? And then it came to a complete halt. So where can people find you? Where's your practice?
Well, it's about 30 minutes north of Atlanta in a suburb called Alpharetta, which is pretty cool. This is exactly where I was raised, so I kind of came home, so to speak, to start my practice. My dad is an ear, nose, and throat doctor in the same area, so it's been really neat to kind of do some cases with him, and that part has been pretty cool.
Great. What are your social media channels so other people can find you?
Yeah, absolutely. Thank you. You can find me on Facebook at Robb Facial Plastics, or on here on Instagram at Robb Facial Plastic Surgery, or on YouTube at Philip K. Robb Jr. MD.
Okay, you got a couple of those.
I
So
know.
myself, my name is Dr. Christina Tansavatdi. I am in Westlake Village, California, and I am in private practice. I'm solo, but I do have a nurse that's with me. We are, of course, not seeing new patients, but I'm still seeing existing patients who just had surgery in the last month. I'm also seeing new consultations via video virtual consulting. And so I do use a platform to see my patients that way. You can find out more information just by going to my website. And if you just go to the contact page, insert your information, it will allow you to schedule your appointment directly from the website. So if you are interested in talking to me, I'd be happy to see you in a consultation similar to this, in a similar format, and we'll be seeing each other over online video. All right, so Laura Comerford, she's already coming out with questions. Do you guys agree with some surgeries doing combos without previous consultation? E.g., the Kylie Jenner package. Are places like these generally poor quality?
Great
Go
question.
ahead.
Should we just jump right into the questions?
Go ahead and answer that one.
So, first of all, Laura, great question. Thank you. And for anybody else who's watching, feel free to send us some questions. This is really low key, and we're an open book. And I know Christina's practiced well, and she knows mine, so we're free to talk about stuff.
Yeah.
As far as this kind of thing, I don't do packages per se, like a Kylie Jenner package. I am going to consult with every one of my patients. Even if it's a virtual consultation, I will see you then in the office to examine you, make sure that this is the right thing. Pretty much every day, I'm going to talk somebody out of some kind of surgery that they wanted, which initially people are like, what the? But I just do what I feel is right for them.
Right. I agree with that. I don't like naming certain things by a package either. I know a lot of doctors will name things after their name and say this particular lift. I don't believe in trademarking anything. I think that a lot of the things that we do is very similar from surgeon to surgeon, and skills are definitely, I know some very skilled surgeons, and I know some, but across the board, we have very similar training. So to say one surgeon is better than the other, I'd say it's more the difference between a surgeon that understands you and listens to you versus somebody who just wants to do their technique with you. So you want to find a surgeon who's going to really listen to what you want and get you what you're asking for, rather than saying, oh, well, I see this and I see that, and so let's just do this whole thing for you. I don't think that's the right way to handle it. Because in the end of the day, you have to be happy with what you had done. And so if we suggest all these different things, you might say, well, that's not what I really wanted, but they told me that I needed it and I believed them. And we're in a position as a doctor, we have what you could say like authority figure, right? So that you think that we know what we're saying. And sometimes it might not be the best thing to just listen to what your doctor says. You really want to go by what you want to address. So that's my take on that.
Totally. And to piggyback on that, just be careful whenever you're seeing things on a named facelift or a named facial combination. It's all marketing. And so when you get down to the end of it, the AFPRS, which is the American Academy of Facial Plastic and Reconstructive Surgery, I think was it 2 years ago, but they sent out a survey about facelift. Basically, what is a facelift to you? What is a weekend lift? What is a mini lift? And as far as I recall, Christina, the results of that was like, there are no straight definitions. Everybody calls things kind of differently. What's a facelift? What's a face and neck lift? And so
correct.
You want to consult with your physician about what your problems are, and then they might call them different things, but just if you're getting different comparisons on different doctors, make sure that you're comparing apples to apples and that your concerns are going to be taken care of.
Right. All right. So Ali Reza says, do you do psychiatry consultation regularly to exclude if they have body dysmorphic disorder? Would you
Great
like to
question.
take a stab at that one?
Yes, these are great questions, guys. The answer to that is I do not regularly do that. No. I have done that when I am pretty sure that this is what's going on, but the I'm generally going to meet with my patients a couple times before we do a surgery. Usually more, I meet with them even more for rhinoplasty than upper blepharoplasty, which is like an upper eyelid lift or something like that. But I let all my patients know that doing anything to your face, even something as simple as filler, can be emotional. And so some patients will have kind of an emotional response, especially this has been documented after facelift, and you're doing kind of multiple procedures kind of in one setting, that it can be a little bit emotional afterward. So, those kind of things are good to talk about on the front end, so that expectations can be set.
Well, I'm going
But
to
yeah.
just explain a little bit what body dysmorphic disorder is for those people who are listening. So, body dysmorphic disorder has to do with somebody seeing something out of proportion from what, so it will usually be several areas of the body. It's not just one portion, but it typically migrates from one area of the body to the next. So you might not be happy with your nose, and then once that's, better, you start to obsess about another part of the body. But the word is obsession. It's obsession out of the ordinary. And what we normally see is that there was actually a study that came out from, I'm blanking out on it was a group of different places that they did this study, but the number of patients who have body dysmorphic disorder in a typical facial plastic surgery office is about 20%. So that's 1 in 5 of our patients has body dysmorphic disorder. And so I am not routinely sending them for a psychiatry consultation. I don't send every one of my patients. That would be a little overkill. But there are certain questions that we ask to make sure that we're doing it the right reasons for the right patients. So those are typical screening questions that we have for body dysmorphic disorder. And there are certain areas that are more common than others for body dysmorphic disorder in our practice. That would be rhinoplasty and ear surgery. So in those two cases, I usually am very hesitant and will screen pretty well before I move forward with those two cases.
Mm-hmm.
All right, so Mother Healing asks, do you think this pandemic will change the way people think about plastic surgery? I'll take that one first.
Thanks.
I do think that it changes people's perspective for sure. Sometimes I look at on a day-to-day basis, just being home and going, I feel blessed just to be able to be alive and to have family members that are still alive and that we get to still do things from home, especially for the people who can still work from home. I think this has changed a lot of our lives and will continue to do so in the next few months, even into the next few years, how we approach things, particularly because what I do is a service-based, it's a service, and so not everybody needs to or wants to have plastic surgery. But I think that there will still be people who do want to have things done, who do want to have plastic surgery for things that they're not happy with and they're bothered by, that will give them the improved self-confidence. In this day and age, we are very much so relationship oriented, and even more so into the future. What we do from everything from our jobs that we do does involve getting to know people, getting into relationships. And so I don't think there will be a lack of. Will there be a drop? Yes, I do think there's going to be a drop because we're going to change our perspective of what's important in the first few weeks as we come out of this. I think most importantly, the first thing I'm going to go do is I have to go to the nail salon and get my nails done.
Me too. Totally.
Yeah.
I think I think that is something. So I was on a Zoom, like a virtual meeting call, with a bunch of people in our industry last night, And for those of y'all don't know, you can picture kind of like the grandfathers of facial plastic surgery at this stage, who, people who are in their 60s, who've kind of paved the way for Christina and I, and they're on their Zoom looking at their face, and a lot of them started doing. They're like, "Oh, guys, we need to talk about this." So we kind of jokingly postulated that with all of these Zoom meetings, there's a whole lot more selfie talk that's
Yeah.
going on. But I agree, though. Um, I think temporarily where there will be a little bit of a lull as people kind of get back to normal, and I think that also depends on how long this lasts, what the stock market does, and how broke people feel, for lack of a better term. I mean, how hard they're hit essentially in the economic downfall from this. But I do feel that this will rebound. I mean, people always care about what they look. That has never changed. And then I think that there will always be people who want people who are the specialists, like you and I, Christina. There will always be people who want to stay at the Ritz-Carlton or the Four Seasons as opposed to the Hampton Inn, or nothing wrong with those places, but there'll all be people who want kind of nice, high quality service, which is kind of how I run my practice.
So Dr. Young says this, and I think that I agree, and he made a great point. He basically echoed what you said, but it will likely change their perspective, but not necessarily the way they think about plastic surgery. However, with all this free time, selfies and TikTok videos, people will notice more, definitely. But then also
Dr.
just
Young.
knowing what's important to them too in their lives. I think that's important too during this time.
Totally.
All right. I have some comments. Do you have some comments from patients that put up some stuff?
I do. Yes, I sure do. So some of them are about coronavirus. Others are about like random stuff. But because I just said, ask us any questions. We're talking about coronavirus, but I'm happy to answer whatever's on your mind.
Yeah. So today's topic is about life in the time of coronavirus. I can share you what things have changed in my life in the last 2 weeks.
Please.
I had stopped reading books for a little bit because I was on this trajectory to read a book a week. And then that kind of went backwards a little bit last year. And so once the coronavirus hit, I was like, I need to get some books. So I immediately ordered a whole bunch from Amazon. I think I've been getting Amazon packages every day.
Nice.
I think I'm one of the guilty ones that's been ordering too much Amazon stuff. But that's what has changed.
What books did you order?
It's a little bit of everything. I was in Cabo in February before this went crazy. And I ran into a mother-daughter who was sharing their books that they were both reading. And it's the book is called All the Light We Cannot See. It's a novel. I haven't read a fiction book in a while. And this one was the winner of the Pulitzer Prize. So I figured it had to be good.
Yeah, it's got to be good. That's amazing. So you've been reading more? Have you been?
Yeah, I've been reading more. This is one that I'm trying to get through right now.
So it's backwards, but it says leadership
is language.
That's hard. I had to read that backwards. Yeah, that's great. It kind of, you definitely are working those self-help books. That's good.
Good. Self-help. I'm trying to be a better leader.
Better person, better leader.
Yeah.
I have a stack of books this high that I have been needing to read, and so I opened the first one last night. But I've got 3 crazy kids, and so we have been doing a lot of kid stuff, and I did some home improvement projects around the house.
Are you reading books to them?
Yes, we have read some books. So the current one that I'm reading for myself, I have not read to them. I don't think it'd be appropriate, but it's called Extreme Ownership.
Oh, yeah.
Have you read this? Jocko Willink and
Jocko Willink.
Yeah.
Have you ever seen him?
Oh, yeah.
He seems menacing. I wouldn't want to run into him.
He's like the quintessential Navy SEAL guy. But this is a true story. So I didn't know anything about him or his company or anything like that. But for those of y'all who don't know, this guy named Jocko Willink is a Navy SEAL, and he was actually in command of Chris Kyle, who's the famous sniper. And their company in Ramadi in 2006 did a lot of great things for our country. But he has created a company now who evaluates leadership, and they've wrote a couple books. So extreme ownership is basically like people like us, Christina, who are do have a position of leadership, and it's basically like owning stuff, even stuff that many people would typically pawn off on other people. When you own it, things kind of come into alignment, which is kind of nice.
Yeah.
Yeah. But he also has a podcast, which is great. I'm a big fan.
He also has some kids' books. Have you gotten the kids' books?
He does have kids' books. I have not seen any of those.
You're going to have to read them to your girls.
He doesn't seem like a kid's kind of guy.
Well, I actually heard his kids' books have sold really well.
Really?
I'm going to have to check them out.
Yeah, I'll check them out.
Yeah.
What else am I gonna do during this time?
So I'm going to reintroduce both of us. So for the new people coming in, I'm Dr. Christina Tansavatdi. I'm a facial plastic surgeon, and Dr. Philip Robb.
Hey, Dustin. My scrub tech just joined in. So
Oh,
awesome.
nice. Okay.
Yes.
So I have a little, I have something that Travel Blues wrote. I'm going to share that with the screen here. Travel Blues wrote, I had asked a question, what do you think will change, or what do you think you learned since the coronavirus? So this person said, I actually don't mind being alone, even though I'm considered a social butterfly.
Nice. That's good.
Would you say you're an introvert or an extrovert?
What do you think? I'm an extrovert.
You're an extrovert. You're an extrovert.
An extrovert.
I'm an introvert.
You are.
I can be an extrovert, but I typically like to have my alone time. So
Totally. Yep.
this whole isolation hasn't been too hard, but these, daily IG lives has been helpful to kind of interact with you, to interact with my fellow colleagues, to kind of just interact with people in general.
Mm-hmm. Yeah, the isolation stuff is killing me softly, I think. Like,
I think I have to get you on this app. It's called House Party.
Oh, that sounds like something that I would be interested
So
in.
you get a whole bunch of people on and you can play games. So last night I was doing it with my sister and my sister-in-law. And so they were doing, it's like a game of charades. So you have to, you have to draw whatever it is. It's like Pictionary. That's right. It's Pictionary. And then you have to guess. And then so many people get the numbers right. And so that was a fun game. Playing as a group.
Definitely include us. I will say that there's been a lot of great things. I don't know what day we are in quarantine and where we are in this, but there's been a lot of Zoom conferences or FaceTime. Like, I have seen my friends actually more in quarantine virtually than I do in normal life, because we're so busy, and I'm the world's worst at like booking up my schedule, and we'll have something like every night of the week, and then it hits Friday night, and then we're like, ugh.
A lot of Zoom, huh?
And so, that's just like normal life. It's just so busy. But now we're Zooming it, which has been nice. So getting to see my high school friends more, and some extended family. It's been pretty neat.
So you're connecting with people. Hi, Miss Lauren Tyler, Jay Lashink, and Falak Karzu, Joe Clam.
Yes.
Man, these are hard names to say.
Hello.
All right, so Ali Reza, I just pinned this comment, said, if you guys don't mind, would you explain the paths doctors can take to become a facial plastic surgeon? Do you have to be an otolaryngologist first?
Okay, great question. You want me to take that?
Yeah, go ahead.
So I'm going to answer it in the form of like a double board certified otolaryngologist. So
Hi, Mary.
so you will do 4 years of college typically. Or you got to graduate from college, and you'll do 4 years of medical school. And then our road was 5 years of otolaryngology or ear, nose, and throat residency, followed by an additional year of facial plastic surgery fellowship. Technically, to become a double board certified facial plastic surgeon, you either can do a residency in ENT, otolaryngology, which is the most common, or general surgery, or I think ophthalmologic surgery, right? Christina, you can do that too, and still
Yeah,
get
hold
the
on. I'm trying
ABF
to clear
PRS.
this whole thing out. There you go. Okay.
There you go. Ooh,
I just
nice.
did this thing.
You are fancy.
I'm playing around here.
But yeah, I think the most common, I would say, like 98% of facial plastic surgeons are through the otolaryngology route.
Yes. Could you go a different route? I think in the US, the American Board of Facial Plastic and Reconstructive Surgery is majority going through ENT route, but you could do a different residency program, and then you would have to do so many cases that you have to present to the board in order to be certified as a facial plastic surgeon. You could go down the route as an international board of facial plastic and reconstructive surgery as well. Those are actually lighter regulations because it's an international board. You're not getting your license and board certification in the US. The US is stricter. So the international board has different guidelines, and so you would have to go onto the international board website to figure that out. But I do believe that you could be in a different training program or residency, and then you would apply by sending all your hours and your cases in order to get certified with the international board.
It is a huge process to become double board certified. That's for sure.
Yes, too many years. I love it when people ask me, how many years did you go to school? I said, longer than it took me from going kindergarten to through college. I mean, through to college. No, sorry, kindergarten to 12th grade. So longer than that.
Yeah. It's like eating an elephant, just one bite at a time. And so if any of you guys who are watching are wanting to become a facial plastic surgeon, Ali Reza, if that's you.
Hi, Haley.
So, one bite at a time. One bite at a time.
All right. Tweety here asks, what is the most challenging surgery you've done in your career so far, and why was it challenging?
Oh, that is a great question.
Oh boy.
Sends shudders
I have to think about that one.
I know exactly what case this is. And she might even be watching, but I did a 5th revision rhinoplasty on a lady. And she had, and you guys touched on this yesterday, the Latera implants. I am not a fan. I have removed a bunch of them.
Yeah.
And she had Latera implants. She had terrible skin and soft tissue envelope. It was crazy. But I think it was like a 6-hour revision rhinoplasty. I used rib and both temporalis fascia.
Yeah.
But in the end, she did wonderful. She's extremely happy. So it was worth it. But it's a long day.
Yeah. I think the most challenging case I had was also a revision rhinoplasty. I think of the things that we do, I think that's the hardest case to do, are revision cases, no matter whether they are a facelift case or a rhinoplasty. But I would say rhinoplasty even harder. Even though it's such a small area, you're thinking, oh, that shouldn't take that long. Just, a couple hours. It can take the whole freaking day. It's going to take 8 hours. Like the case that I did that took that long was 8 hours. And I had to harvest rib. I had to harvest temporalis fascia, which is this lining around the muscle, your chewing muscle. I had to get that. I had to repair a perforation in the septum at the same time. And the patient had a saddle nose deformity because of previous surgery where they lost volume. So I had to build that up. It was really tough. So that was a long case.
Yeah.
It's surprising what you can do in the nose. A lot.
Yeah, and the nose is the surgery that will drive facial plastic surgeons crazy. And some people stop doing them because they can take so long and they can be so tough, but they're very rewarding.
Yeah. All right. So Runiak put up a question here. They said, are plastic surgeons being asked to help in local hospitals with COVID patients?
Great question. So of this panel of probably I think there were 50 of us on this Zoom thing last night, One of them has fellows, which means they are facial plastic surgeons in training. They're doing their 1 year after their residency training, and there are two fellows, and they have been asked to go help. This is in New York City. But if we have if they start asking us, we're in trouble.
Well, I just looked into a critical care course for non-critical care doctors, just to see if I could brush up on my critical care medicine, ICU medicine. Not that I'm really top on that, but it will probably come back to me. It's just going to take a while. But right now, they haven't been asking any plastic surgeons in California because the numbers aren't that high yet. Do we see that it may go down that route where the numbers climb like it is in New York? There's a possibility. I think we started earlier with our social isolation, so I'm hoping that we don't get there to overwhelm the system like in New York. But I have heard of people having been asked who are not plastic surgeons, but separately outside of critical care. So I've heard of neurosurgeons being asked. I've heard of orthopedic surgeons being asked. So different fields being asked to go into the hospital. Because at the end of the day, we have all been trained to do medicine, to take care of patients. Even though we're surgeons, if you were asked, I mean, you did training, you did your internship, and first year was in general surgery where we had to take care of patients in the ward. So that's something that, would I be willing to do? I haven't been asked to, but definitely if I was asked to, I would be open to doing so.
Yeah, no, I agree. And I have several friends who are on the front lines, and I've said that I'm happy to help if needed.
Who's that? Who's that little one?
This is Ansley. She can't hear you because I've got the headphones on, but this is my
Hi,
oldest.
Ansley.
Say hi.
Hi.
Are you going to be shy? We're talking about the virus. What do you have to say about the virus?
No one can get food very much.
What?
What did
Earlier
she
you
say?
said, I don't know, something about food, but earlier she said this virus has got to go. So
It's got to go. Nice.
got to go.
All right.
Yeah, so I'd be happy to help. I have also heard, I mean, a lot of these patients, and I don't know if we're going to get into what we know about the coronavirus as far as like from a medical perspective, but a lot of them are staying on the ventilator with a breathing tube for a long time. And so there's been some discussion about possibly tracheing these patients,
Right.
For long-term ventilator and intubation. So, and so, yeah,
That's hard because particularly when you do a tracheotomy, there's a lot of viral load right there, and I think that's going to put us at a huge risk as surgeons just to be exposed to that much virus. You know, like when we do a tracheotomy, you're making a cut in the windpipe down here,
Yep.
and there's so much secretions that can be coming up. Particularly what we know about ARDS, that these patients go into ARDS and their lungs are drowning. They've got tons of sputum, tons of secretions. Tons of
Say hi.
secretions. And so patients who have come out of this, they feel like they're drowning. They can't
Right.
breathe. They're struggling to breathe. Even though they're on the ventilator, they're not getting enough oxygen, and they feel like they're short of breath.
Yeah,
Because the
totally.
lungs are underwater.
And hi, Latrell Karen. And for what a tracheotomy is a hole in the neck where the airway or the lungs can be hooked up to the ventilator. And so the advantage to that is the doctors can do better pulmonary toilet, we call it, but pulmonary cleaning and suctioning, and then it's not going through the mouth and through the voice box. So that's what we're talking about, a tracheostomy. But yeah.
Yeah.
Hi, Boo. What's up?
All right. Hi, Rodriguez Jr. Hi, Athorn, Heather, and Prince Osatutu. It just came in. So our topic today is life in the time of coronavirus. So if you have any questions, feel free to post them down below in the comment section. If you have questions for us, we were just sharing our experience in the last For me, last 2.5 weeks of being home. And then you've been home for how long now?
About a week.
Yeah.
Yeah, about a week and a day, maybe.
Has anything got boring since?
Yeah, totally. Well, I'll just talk about like initially, I had some friends in California that this was like 2.5 weeks ago when this kind of was first starting. And they said, I'm going to close down my practice for 2 weeks. Christina, I talked to you about this. And you, I think, were right after. But it was like the Friday before the Tuesday that you pulled the plug. And they were like, we're going to close for 2 weeks and then we'll be open. We're just going to take these 2 weeks off. And I thought, this is not going to be over in 2 weeks. But at that point, we didn't know anything about this virus or what this was going to look like. All of this is unprecedented in our world. And, the thought of somebody telling you like, hey, you're going to close your office, like it's just foreign,
Yeah.
So, yeah, but here we are. And so.
Here we are, and we're probably here for another month.
Yep.
Yeah.
I've got a couple questions that people have. I don't know how to do the fancy thing where you like slide it in, but
They should be down below where the question mark is at the bottom of your screen. Do you have one?
Hey, Jay Dixon 87. No, I don't have the question mark. I just have like the arrow or the funky face that you did.
Oh, okay. Let's see if I could put one up. Well, you might just have to type it. See if you could type it in the comment. You could type in the comment.
Oh, okay. All right.
Hey, cool.
Yeah, I'm psychedelic. So it says, can the virus live longer than 14 days? I will type it here, but live longer than 14 days in the body.
Longer than 14 days in the body. Well, if you look at the hi Steve, if you look at the studies that they came out from China, and this was looking at the trajectory of patients who got positive, the length of time that it would be in their system before they, like, if somebody died, they could be a total of 20 something days that they could be sick and the virus shedding and everything. So it could be a long time, actually, even longer than 14 days. If you're saying in terms of they got sick and they got over it, it can be shorter than the 14 days, or it can be actually longer depending on how sick they get. So we know of the patients who got intubated, got on a ventilator, and then went on to live, those patients could have been sick for 20 some days. So during that whole time, they were shedding. And the people that got tested at 5 days, so patients, they were testing in China, everybody. And so there could be people who were asymptomatic, and when they tested them, this was R-1 or R-2. You could check them even before they had symptoms, and they were already shedding virus, and then later on went on to have the symptoms. And so the viral load was high enough even before they got sick. So the virus can live longer in the body for a while. So that's what I would have to say about that.
Yeah, and totally. And I think the scary part when you're looking at viruses and characteristics of like a virus that can spread is ideally something like this. You can be asymptomatic, feel great, no problems for 14 days and be, possibly giving the virus to other people during that time.
Yeah. And the hard part is because the fact that the average amount of days before people have symptoms is 5 days. So you could be walking around for 5 days symptomatic, and asymptomatic, 5 days asymptomatic, and still be shedding the virus and passing it on to everybody else. So yeah, it's interesting, all the data that's finally coming out. At first, I did not want to believe this. I said, okay, I looked at the numbers, like, this is not going to be coming here. It's like, this is a thing that's happening in China, right? I think we duck our heads down because it's like, we're busy in our day-to-day lives and don't take the time to really even read the information, the studies that are coming out until it hits closer to home. When the first few cases happened in Seattle, that's when I started to become a little bit more suspicious of what's happening. And then when San Francisco closed, the whole San Francisco area, that was then I was like, oh shit, this is real,
Yeah.
you know?
Yeah. When you start seeing things close and like big, what was the big things that started closing around here? Airlines were starting to shut down. And it was like, wow, okay,
Hi, Angela.
this is not
Hi,
going
AC.
anyway. Hey, Chris
And
Massey,
Chris. All right.
and
I'm
Dr.
going to
Greg.
post a little question that I got here.
Okay.
So the question here is, I've gotten mixed messages on whether we should wear masks or not. Should we? What
That's
do
a
you think
great
about that?
question. Hey, hey, Miss Julia, good to see you. So hold on one sec. Hey, Chan, one sec, baby. I like, so I've seen actually different literature that says, we should wear masks. Here's a curve of people who did wear masks, which is a lot flatter than people who didn't. And I have been that guy wearing a mask around, like to Costco or wherever I'm going. Um, but I also have also seen some research that shows that maybe masks are not slowing or stopping the spread. I like wearing them. If no other reason, when you're wearing a mask, you don't touch your face.
Yeah.
And so that's that. And then there are definitely facts like an N95 mask, which is the safe for the respiratory droplets. That's really only good for, I don't know, I've seen different things, but like a couple hours. And then if you rewear it the next day, it's not quite as effective as it was the initial day.
Yeah.
What are
Yeah.
your thoughts?
Well, I think from the standpoint of everybody, whether you're positive or negative, right? Because the hardest part is knowing whether we're positive or not until 5 days later, right?
Mm-hmm.
Because then you have symptoms. So, and then there's also people who are
Hey, Dr.
asymptomatic
Kim.
completely, where you've got no symptoms, but you do have the virus and is shedding it. So I think it should be that everybody wears a mask, whether you know you're positive or not, only because they did show, and we'll know for sure down the road, but the numbers in Korea and the numbers in Japan are lower, and you would think that, well, why they got one of the first few cases first, and then it went really crazy for maybe a week or two, and then it slowed down from there. But their culture is where everybody wears masks. It's like when they get sick, or if there any concern about some virus going around. And I think this is something that they learned from the SARS virus that happened way back in 2008. So just from those data, that 2003, when they had the first SARS virus, because of those deaths, they kind of ramped up the people wearing masks, and you can see that their numbers are much better. So if I were to be, I mean, there's no harm in doing so. So I would say yes, that everybody should be wearing masks. Now in Los Angeles County, because of sorry, not Los Angeles County, it's the city of Los Angeles. The mayor of Los Angeles has issued an order now here that that suggests that people should wear masks going out. I don't know if that's complete order yet, but I doubt that this is gonna just stay in Los Angeles. It might start spreading throughout California, that they're gonna have everybody start wearing masks if they go outside.
And are you guys officially on the shelter in place order?
Yeah, we are. Yeah.
We are too, as of I think yesterday. So we're definitely
And
like a little behind you guys.
Mother Healing says that's because Singapore was testing really early as well. Yes, and Singapore, they're very strict in Singapore. They are tracking, as well as in Korea, they were tracking by GPS, so you don't have any privacy. They were tracking your phones to know where you went in the whole 2 weeks time span, to make sure to track back where you were and who was exposed. And they isolated everybody.
Well, and maybe
Unfortunately, I
somebody
don't
can,
think that will happen in the US.
yeah, I don't know if well, maybe they can do it, but if somebody maybe could comment too, I've heard stories of like the phone will turn a different color. So your phone is green, or some aspect of your phone is green, meaning you've not come into anybody who's tested positive in the last like 14 days for the virus. And then if your phone turns yellow, that means that you have been in some kind of contact with somebody who did test positive. And then if it turns red, that means you've been like somebody around somebody who's acutely infected.
Wow.
I know.
That would be
That
crazy.
this
And
could be a
everybody
rumor.
has their
This
phones
is
with them. So
yeah,
that'll be a great marker.
and so they just kind of watch. I guess I don't know how the technology works, but this person tests positive, and then whoever was around that person for that day is like they just turn everybody yellow or red. I guess I don't know.
Yeah. Do you think there might be a resurgence in wearables? Like instead of just like, we have phones, but instead of wearing phone or having our phones and carrying it everywhere and getting it all dirty, wearing remember those glasses, those
The
Google
Google
glasses?
glasses? Yeah, I don't know. I never really jumped on that bandwagon on the Google Glass thing. I bet you
Yeah.
had a couple pairs of them because you're like cutting edge like that. Um, but I never. I don't know. That's crazy. I do know there are some facial plastic surgeons who are making their own surgical gowns out of cloth,
Oh, wow.
so that they when they're given the green light, they can get it going because there's probably going to be a delay in getting our normal personal protection equipment,
Huh.
which is
Interesting.
which I thought
I know
was
they're
a
using those gowns, not gowns, sorry, towels, the OR towels and stuff, and using it to create like the whole setup for the
hmm
PPE in, I think it was Spain that I was seeing them doing that.
hmm
So Dr. Michael Kim says here, Governor of Georgia just found out that asymptomatic carriers can pass the virus on. Did you know that?
yeah, that's Dr. Kim, we're a little slow down south. You guys on the north, the northwest. Um, yeah, we could have been in denial a little bit here, but the humidity's a little thicker and our gravy's a little thicker, so the virus doesn't spread quite as quick. It's our thought process.
Yeah. Hi, Dr. Sam Coe, and there's also the Cleveland, probably nurse practitioner NP, and
Sweet.
Ab Serafini. I
I
blame you,
blame you.
Dr. Rob.
I blame you, Dr. Kim. That's great.
All
That's
right.
great.
So I did have another question here. I think along the same lines, this was Ali Reza posted. Is it necessary to wear surgical or N95 masks when going outside? Because first it was believed that the virus is transmitted via droplet. I think I couldn't read the rest.
Okay. Well, I would say that if you have an N95 mask, wear it. Wear it if you go outside. But if you don't have an N95 mask, wear any mask. I think that any mask is better than no mask.
Yes, I would agree with that. And I would actually say just please don't hog the N95 masks that are really needed for our healthcare workers, because the N95 masks do a better job, particularly of preventing the particles from going through. If you've seen any N95 masks, they're specifically made to filter out 95% of the particles. And the particles, the droplets coming from the virus itself, is small enough to get through, actually, the regular mask on the sides. Because if you wear a regular mask on the sides here, it can come through. So you really want to reserve the N95 mask for those who are really in harm's way, who are just right in front of the patients, where they're going to get the most load of the virus.
Totally. And if anybody has a real N95 mask, so as healthcare workers, we're actually trained to put these things on, and there is actually testing. So when you put on an N95 mask, these things are not comfortable. You do not want to wear
Yeah.
these around for fun. They are painful. And you may have seen pictures of healthcare workers. I think there's some circulating in pictures from Italy. They're bruised, literally.
Yes.
And so at the very early stage of this, I wore an N95 mask in the office, and for one day, it killed my nose. I mean,
Yeah. Yeah, I
not
see people, and you can see the bruises and everything on their, and the chapped skin. So Brow Designs by Julia asks, so I wear a shield at work. Is that helpful? I guess it depends on what kind of work you do. If you're right in somebody's face, you have a high likelihood of getting a lot of respiratory droplets in your face. If you're doing brow work, if you're doing permanent makeup with brows, I would say that a shield is better than nothing. So I would say still wear a shield. But if you have somebody who's actively coughing, then the shield's not going to do anything for you.
Yeah,
It's still
definitely.
going to, because the when you breathe in, even if you have a shield, the direct contact's not there. But when you breathe in, what happens is the negative suction that you're doing when you breathe through your nostrils will pull the respiratory droplets around the shield and breathe it into you. So if they're actively coughing, for sure, it's not going to help.
Mm-hmm.
Ivana P. Nassif, hi.
Hey.
And then Dr. Memes. All right. Do you have any other questions?
I do. How about this? This is another question. How hard is it to thin out a bulbous tip during rhinoplasty?
How hard is what?
How hard is it to thin out a bulbous tip during rhinoplasty?
Okay, so this is separate from the coronavirus right now, right? We're going to another world.
I'm being loyal to my people who ask these questions, okay? This is what's happening here.
All right, so I'll tackle that one. How hard it is to... So if it's a bulbous tip and the skin's thick,
do you want to talk about what a bulbous tip is?
Huh?
Do you want to just 2 seconds talk about what
sure.
a bulbous
yeah,
tip
yeah.
is?
Let's back up a little bit. Thank you for telling me that. So bulbous tip, bulbous nasal tip, just sounds like what it says. It's round. It's large and round. So it's a ball on the tip of the nose. So when we try to address that for rhinoplasty surgery, we have two things that we have to address in the tip of the nose, because the cartilage gives shape to the nose, but besides the cartilage themselves, it's also the overlying cover. It's like a mattress on a bed, that the mattress can be thin or it can be thick. And the mattress cover, should I say. And the mattress cover, in this case, for a thick-skinned patient will be thick, and the cartilage underneath can't show as well. And even though you've done all your work, which a lot of what rhinoplasty surgery does is working on the structures, the solid structures underneath, the skin cannot be shaped as well. So if you can thin it, but it still won't take a bulbous tip that is due to a thick skin. It won't shape it enough. So that's hard. And so some other techniques that we use is to tent that skin. So instead of thinking a mattress cover, and if you build up underneath that mattress cover, put something really sharp underneath, then it will show a little bit more so that it shows the structure more. And so we can do that in those cases. But I always say, if you've got thick skin, I always have to counsel patients that they might not be able to get what they're looking for. Not a sharp tip, should I say.
Mm-hmm. Great.
How about you?
Great. I think I tell my patients kind of with rhinoplasty, and then Claudia, we're coming right back to you about the masks. We're gently lifting up the skin, changing the underlying structures. The nasal tip is made out of cartilage, and so there's some things that we can do both with actually just reshaping the cartilage, either by trimming some of it or by using sutures to kind of narrow it, or grafts. But then a lot of times I'll thin the skin a little bit of what's appropriate. But yes, we're limited to the canvas that we have to a certain degree.
All right, we have two questions actually. Nat Kansky asks, what do you say about the droplets that go beyond the 6-foot guidelines?
Those are some crazy droplets.
Yeah.
Those are some droplets on steroids.
That's somebody like sneezing really hard. Have you ever seen those videos where they do a slow motion of the sneeze and how far it can go?
Yes.
I mean,
those are beautiful videos for sure. And like the deformation of the deformation of the face and all that. But yeah, I think you have to be careful. Christina knows I'm a big cyclist. And my buddies are like, today we're like, hey, let's go on a long ride because we have all this time. And I'm like, no, I didn't do that. One, because Christina said, do not ride before our big time Insta Live. But I want to mention this just publicly, is that, if you do things outside, like, ride a motorcycle or ride a bicycle, during this time, you have to be extra cognizant of that, because our medical services don't have resources potentially to take care of injuries right now. So if there's like ever a time where you should temper your activities down and really be careful, drive safer, definitely don't text and drive, even though nobody ever does that anyway. But now is the time to really like just be careful. We don't have resources. We are like stretched thin already. In
So I
fact,
would say though that droplets could possibly go beyond the 6 foot guidelines,
I think
but of course it had to be carried by some force, either some wind or something to carry it that far.
yeah.
But typically droplets they don't just go on their own. They'll probably linger and then fall down to the ground or fall on a surface.
Yeah, and there's been these weird things that I hear, like from this cruise ship, that the particles lived for like 17 days or something crazy. I
Right.
don't really know what to believe, and I know that we're still learning about this, but I think all in general, just be careful. Um, so if they say 6 feet, I mean, if you can do 8 feet, great, do that.
Yeah. All right. So Claudia, by you, which you earlier were addressing, do you want to address that question?
Yeah, it says in Brazil there aren't masks for everybody. We are making masks for donation. What kind of fabric can we use? Hmm. Well, I think any fabric is better than no fabric, but definitely, like what Christina was mentioning before, one thing that's almost as good as like a normal mask is in surgery centers, and for surgery, we wrap the sterile instruments in this thick blue. I don't even, what is that called?
I
This,
don't know, but it is porous though because it allows the steam to go through to sterilize it. So it
yeah.
still has to be in that sense. Now, when you're using a mask and you're using cloth, every fabric has, of course, a weave, right? You've got like a weave pattern of
Hmm.
the fabric. So it's not going to, it's still going to allow some particles through. But the way that has been helpful, which they did in China, is they wore masks upon masks. So what you could do, even though you're using a ton of cloth, it's still going to help better than not using anything. So you could take the cloth that you're doing for one mask and overlap them like they did in China. The other thing is that the N95 masks are made a certain way, and people always ask, well, how come we don't have more of them? Because it's so hard to produce, actually. So they're actually a mold. If you've ever seen them from 3M, which is a major producer of them, it takes a while to make. So their production is about 3 million per month, I think they were saying. They can't produce like a ton just overnight. And that's why we're so backlogged, because it's the whole world that needs these masks. It's not just the US. And so this was actually like a sort of a perfect storm because it hit China first. China ate up a lot of the resources, and a lot of the production for these masks come from China. So they hoarded it all them for that time being, and then they didn't have any new production. So it hurt the rest of the world. And that's why we see this PPE shortage. It's not just because, the government wasn't preparing. It was because we only have so much in our suppository or whatever, wherever we carry them. And the companies are making them, but they can't make them fast enough.
Yeah.
So,
And do you know what? I feel kind of guilty because I have this crazy story. One of my patients is pretty high up at Halyard, which is one of these companies who make surgical masks. And I don't know, this is like January, like early January or something. He tells me, you need to buy some surgical masks because China just sent 4 massive like cargo planes, and they are coming and they're filling up those cargo planes full of masks for some virus that they're dealing with over there. And so I was like, huh, that stinks for China, And here I am.
when was this?
This was probably like January. I
Oh my
mean,
gosh.
it could have even been December. I mean, it wasn't even on my radar. I don't
Yeah.
know what goes on in China, like on a daily basis, or if they've ever done that before. Like, is this a common? I don't know. But yeah,
Yeah.
so if you think of how many masks they can fit on 3 massive airplanes,
Oh, yeah.
that's a lot. And that was in January. And so,
Right. And how many masks they were going through? Because remember, I told you they were putting. Have you seen the video where they show the just their protocol for how they dressed up?
no.
So all the doctors, when they dressed up, they would put this suit on. Right. First, they would put one mask on. Then after that, they had this wrap around them. Then they had the suit. Then they put another mask. And then they put some other wrap again. And then they put goggles. So they went through, I think, 3 masks per person just to suit up.
Okay.
To go take care of the patients. This was every doctor.
That's crazy. And how about this? Also, this is interesting. The old swabs, the initial swabs were nasopharyngeal.
Oh. It stopped. Oh, I didn't know that. Holy crap, I don't know what happened. That was the first time I've, wow, okay. So, Dr. Robb, I think you blew the system.
No, I think you had to put more coins in the machine or something. Jeez. You know,
That's the first time that happened to me.
I was right at 7, so I don't know. That's weird.
Yeah, it's probably because once you get to an hour, it says, "Are you still watching? Are you still there?"
I'm here. I don't, we lost our.
It's like the Netflix. You seen that
totally.
one?
Yeah.
It says, "Are you still watching?" Turns it off.
I just think you need to put more coins in your phone or something. That's the problem. What were we even talking about? Hey, Mother Healing, thank you for coming back. You guys are.
Thank you. Yes.
You guys are strong.
Yeah.
So I forget exactly what we were saying about the masks and putting everything on.
Yeah.
Yeah.
That's a lot of masks though to go through. Like
yeah,
we were
it is.
saying.
And what I was saying was the old test used to be a nasopharyngeal mask or a nasopharyngeal swab, which patients would cough and gag and all that. And so every test, they had to re-up all of their personal protection equipment.
Oh, you're talking about even now when they do the
Yes.
testing?
No, it's changed. As far as I know, another patient I have their company came out with a new test, which is just an anterior nasal swab, just like right inside the nose.
Oh.
That doesn't, and so this is a test that actually can be administered by the patient. So in these drive-up centers,
Right.
there's a person in equipment and personal protection equipment handing the person the swab in this almost like a culturette we would use, and the person just takes this out, puts it in their nose, puts it back in the
Right.
thing.
And they're supposed to get it all the way back there, right?
Well, that's the old kind. You don't have to do that anymore. What they
Oh.
found was that the virus is so virulent and such high quantities in the nose, you don't have to hit the nasopharynx. It's just all over the place in there.
Yeah. But I heard also the numbers are not as high. So like if you did a swab, I think the sensitivity was 60-some%. So you have a high negative rate too. So you could have, 30 or 40% that are
false
still, they're positive, but they just don't know it. And so they have to repeat the tests. So I think that's what they did in other countries is they had to have 2 negative tests before they allowed somebody to get out of isolation.
Gotcha.
Yeah. I think didn't Nat ask a question? I don't know. Before it closed off,
Nat,
there was
can
like
you ask it
something
again?
posted and I didn't get a chance to read it.
Maybe Nat can ask it again. Christina just put a couple more coins in the machine, so we should be fine if you're just joining us.
This has actually been a very good session, Phil.
Yeah. That's because you're awesome. Thank you so
that's
much
'cause
for
you're
having me on. I have a bunch more questions, but I'm going to try to keep them. So if you're on a follower of mine and you asked a question, maybe we'll get to it a different one when we're not, because some of these are non-corona questions. And I think what the people want to hear is about the coronavirus. I think so.
Yeah, they do. I think we can do another topic again, particularly if somebody has questions that have to do with surgery or something that you do or I do. Hi, Dr. Michael Kim. Oh, here we go. Nat just asked, or just said, about mask shortage, usage, and how to sterilize given the shortage. Thanks for adding coins.
Yeah, I don't. What do you say about sterilization? So I have a mask that I've kind of been using. It's just hanging out in my car. I'm not re-sterilizing it.
Me
Maybe
neither.
I'm just kind of
Yeah.
rolling with it, and anything's better than nothing. We're doing the best we can. And then here's a big tip is that if you wear gloves, like when you go into the grocery store, get out of your car, put your gloves on, and go do your grocery shopping. Then when you get back to your car, get your groceries in. Then before you get into like the driver's seat and touch your steering wheel and all that, take your gloves off. So,
Yes.
so just because we have gloves on doesn't mean like nothing's going to transmit anywhere. That's just kind of like a layer we
So
can
when you
shed
touch
off.
anything, yeah.
Right.
Actually, also when I bring my groceries back in, I have a little routine now. There was this video that somebody put out, a physician in Michigan. I thought it was pretty good. And hi, Dr. Danes, I see you.
Hey.
And so I clean my counter, and I divide the counter. One side's the dirty, one side's the clean. So when the food comes, I put all the groceries on one side, and then I take a wet towel that's sprayed with Lysol, and I wipe down all of the packaging. So if it's any plastic, it's all wiped down. If it's cardboard, then if I can dump the stuff out of the cardboard, I do. It's harder when it's eggs.
Yeah,
I have to find some cloth and I gently pull each egg out. But yeah, so I'm actually cleaning everything when I get it because I don't know whose grimy hands has been on it.
True.
Even though you have your gloves that you do to grab things at the store, but I've heard that even though things are stocked and you can grab something in the back, right? Like what I like to do is if the food is up front, I try to grab a bag that's way in the back, thinking that nobody's touched it. But some of the store workers have gone positive. So they're stocking the shelves, right? So I just spray everything. And Natalie says here, I spray everything with alcohol. Yep, alcohol will work too. Just make sure that it is above 60%. I think everybody knows that already, but spraying
Danes
down
knows,
with alcohol.
Danes knows about a 60% alcohol. OSHA would be proud of your situation, by the way, your clean and then your contaminated side.
There you go.
OSHA would be quite proud of that.
Sterile technique.
We in the Robb house, we're not doing that so much. We're just kind of rolling with it. We're putting the stuff away. We're washing our hands.
Yeah.
And I don't know. But we are doing like we'll pull up to the grocery store and the people will put it in our car.
Oh, there you go.
Do y'all have that over there?
You know what I've gotten asked? I've gotten asked whether it's better to just eat out, take out. Is that safer than going to the grocery store? What do you think about that?
Well, this is an opinion. I'm purely postulating. I have no data for this, but I don't feel like eating out is particularly risky.
Yeah.
I don't know. I feel like in eating out, you touch less. But
Yeah.
again, if I don't think we're not going to get the virus by eating something. So if you eat a chicken finger that's been fried, and has
Yeah.
a piece of virus
And you
on
would
it,
hope that their hands are clean.
you would
Although
hope.
they said that the virus does get shed in the GI tract. So that's how they thought maybe that's how the cruise ships, how people were getting so infected as well. Is because if they weren't washing their hands properly and then they were managing the food, the people who were on the workers on the ship. Who knows? But the way the virus works, it works on a particular enzyme that's found in our lungs. It's found also in the heart. So a lot of the patients were getting myocarditis, but it's also found in the GI tract. So that's why they think maybe, because some people were getting GI symptoms and didn't have any other symptoms, but a little bit of like diarrhea and stomach upset. And I had, maybe 2 weeks ago, I had like one day where I was like, a little bit stomach upset. And like I thought low-grade fever, but now here I might be a hypochondriac. So I don't know if I thought, shit, this is going down. Maybe I have some symptoms. Never
Hey,
got tested, but
maybe
hey,
you have it
it was
and you
like
cleared
4
it.
hours and it was gone.
You had it and you cleared it. You're
4
good.
hours. I don't
You're
know. I don't think so.
you're good to go. Yeah. Hey, Elazar Wells, Miss Prada, Sue Michelle. Um, yeah, we are talking. What about this? This is another question I have. What are some tips that we can offer to help strengthen the immune system at this time?
Oh, that's a good one.
Hmm.
Do you want to know my routine?
Yeah, I think everybody wants to know this. Yeah.
My routine is every time I go out, so if I see a patient, even though I'm wearing a mask, wearing gloves, doing all the right things, if I see anybody that day, that night when I come home, I take what's called a wellness formula. Let me see if I can grab it.
Okay.
Um,
And while you're grabbing that, can you still hear me? No.
so it's this wellness formula,
Hmm.
and it has like echinacea, elderberry, garlic bulb, and I swear by it because anytime I get sick or I feel like I'm going to get sick, I pop a whole bunch of these pills and I take emergency and I load up for like a day or two, and then after that the symptoms go away. So that's what I do. And then as soon as that whole thing struck with social isolation, when I tried to go to the store to find it at my local grocery store in Sprouts, the whole aisle completely gone. And then I tried to
Mm.
order online and it was like back ordered for a month. So I'm lucky to have just gotten this. I
Yeah.
had a whole package of them.
Yeah,
But that's
and
mine.
I have read a paper that shows that zinc is good. So if you, I'm sure this wellness formula maybe has some zinc in it, but if you can get a little zinc supplement,
Yep.
supposedly that's a good thing. And the virus does worse if you have a good amount of zinc in your cells.
Yeah.
So my wife has me now taking some multivitamin, which normally I don't do, um, but I'm doing it.
So
No
you're
shit.
taking it with the kids?
Yeah, it's like a Flintstone gummy type thing, and I'm taking some vitamin C on top of that.
Yep.
Here's a real question for you though. So when you go in and you meet a patient, maybe for the first time or it's a return patient, you
Yeah.
would shake their hands, correct? In the
Yep.
past. Will you do that going forward?
Well, so I think it was the last 2 weeks before I closed, every patient I was meeting was like
Right.
elbow,
Right.
elbow. That was the
Totally.
new thing. And then the other thing that we would do is this is a very typical Thai bow or
Hmm.
respect. So when
Hmm.
we say hi in Thai, well, so my background is my parents are Thai. I'm from Thailand. And so when we say hi to somebody, we go Sawatdee ka and we bow and so that was like the new thing. And my aunt, she came back. She went on a trip, and when she came back, she was like, "I'm trying to teach every one of my clients this is how you say hi, no handshake."
Yeah.
So that was cool.
So when this all kind of goes, and we're better and life's kind of back to normal, quote unquote, will you
Yeah.
shake hands or will you
No,
do?
I'm just gonna say this is how I greet patients. I'm Thai, and this is how I greet patients.
Can I use that?
Yeah.
I'm gonna
Why
say I'm
not?
I'm gonna say I'm Thai too.
Yeah, you're an honorary Thai member.
I am Thai, yes. And so, but really, I've thought about it. Like, I haven't, you know, I've thought
Yeah.
about like maybe I'm not gonna shake so many hands.
Dr. Mila just greeted you.
Hey, Dr. Mila. She'd be proud of me doing an Insta Live.
And then Ali Reza said here, it is encouraged not to eat outside so people wouldn't be in close contact to each other. So, yes, but there is still like takeout. So I think that was the question that I had a patient ask, if takeout is better than going to the grocery store and cooking. I mean, I guess if you have your enough funds to take out every night, but getting takeout is helpful for the small businesses. But what I hear is that it's not getting them enough revenue
Hmm.
to stay open unless you're a takeout business to start. But if you're one that normally resides on, having clients come in, then takeout doesn't really do much for them. So, and pretty much I've been trying to brush up on my cooking skills.
Yeah, we have the time for sure. My in-laws own three restaurants, and it's been tough. It has been tough and so as you can imagine, but they're it's a pizza, pasta, and salads, and so they had a delivery business, but I don't know if it was a huge percentage. But now that's all they're doing,
Yeah.
takeout and stuff. It's been tough. So
Yeah, that's definitely hard. I think every restaurant is hurting right now.
hmm
Hi, Jeho 5IA. And
hello,
Veronica. Hi, Veronica.
hey guys, thanks for joining in. We're talking about coronavirus with Dr. Christina Tansavatdi, facial plastic surgeon in California.
Yep. And Dr. Robb Jr. in near Atlanta, Georgia.
hmm
And we've got somebody here from Indonesia. How is it in Indonesia right now? I guess, what are the
Yeah,
numbers like in Indonesia?
yeah, would love to hear about that.
Are
And
everybody
I
wearing masks in Indonesia? Hi,
it
Diana.
awesome. Yeah, this has been crazy because it's a worldwide thing. So in this, I did this Zoom conference last night with some other facial plastic surgeons. We had four continents,
Mm-hmm.
and one was Australia,
Mm-hmm.
and it's effective. It's changed everywhere. I mean,
Yeah. And they just went through the whole fires in Australia. I don't even know if the fires are out. Are they?
I don't know.
I'm not sure.
He didn't comment on the fires, but they were still doing a little skin cancer, and he was still operating. We
Uh-huh.
met like last night at like 9 o'clock, and whatever time it was daylight there, and he was going to do another case. So
Wow. Yeah.
whatever, I don't know the time
Are
difference,
you
but
doing any cancer cases, lacerations? What kind of cases are you still doing in your office?
um, so I did a laceration for my sister-in-law last Friday night. She cut her finger open.
Oh,
So I did that, and then as far as you know, I'm able to do that. So if somebody were to call and say I have a laceration, I think I'll take it on a case by case basis, but I have to just stratify and be careful about exposing my staff
mm-hmm.
because one of the important things that I think everybody needs to understand is as this peak goes up,
Mm-hmm.
it's going to be a lot more prevalent, and our risk for going to the grocery store or going anywhere is going to get higher.
Yep.
And then the other problem with that is that we don't know where the peak is until we're
Mm-hmm.
beyond the peak.
Right. Yep.
So I'll take those on a case by case basis. I have not been asked to do any cancer reconstruction. I know that at least two of the Mohs surgeons who refer to me are have stopped.
Yeah. Okay.
Yeah.
Yeah, I have got some dermatology colleagues too that have died down their, their business, and then also a dental place that has also just limited to emergencies, particularly because dental cases, you're in the mouth and you're suctioning and you're just getting these particles up. So it makes sense that the Dental Association kind of cut that out
hmm
because
Hey,
of that high
Elazar. Hey,
risk.
Morgan. Yeah, totally. And I think the American Dental Association actually let out a statement saying, please close and
Yeah.
emergency only.
Yeah, and that's important for you guys to know too. Our own academy, their statement, as well as the Academy for, or the American Society of Plastic Surgeons, all the different societies, you may have heard or not, that we have told our fellow colleagues that it's not wise at this point in time to be open, particularly for any elective cases. Certainly for any emergent or urgent cases, we are still seeing, but anything elective, it's not worth the risk to cause any more spread at this point in time.
hmm
Nat Kansky asks, can you guys do a session of jowls next time? Why can't it be done from inside the mouth and lift time from inside there? That's such a good question.
Sure, that's a great question.
Yeah, we should
Yeah,
totally do that.
we can do some.
Rob, I think we've got enough people who are just joining and love seeing your face and seeing your comments,
Yeah, right. That's what it
hearing your
is.
comments.
That's what
I
it
think
is.
they want you on again, so we should totally do a second round, part two.
Sure.
But this time it could be life in the time of coronavirus for two plastic surgeons.
Yeah, totally. That's what our book can be titled when we're done with all of this.
Maybe we could bring on Dr. Michael Kim and
Yes.
Dr. Stephen Daines too.
Hey, those guys, we would have a fun time doing that.
Yeah.
So I am doing a Instagram live tomorrow with Dr. Michael Kim.
Oh, nice.
And so I don't know if we've figured out what we're talking about yet or not, but hopefully, Christina, you'll be able to look at that, check it out.
Yeah. You guys should talk about jowls.
Maybe we will. And hey, Nat, maybe we can, if we can figure out a way to do it in the mouth, I think that'd be pretty sweet. But we'll talk about that next time. So stay tuned for
Yes.
part two.
All right. Very good. So before we end, how can people find more out about you, Dr. Robb Jr.?
Awesome. Well, you can learn more about me on my website, which is robbfacialplastics.com, or on Instagram. Pretty much my entire life has been on Instagram now for the last couple of days, and that's at Robb Facial Plastic Surgery. We're on Facebook at Robb Facial Plastics, and on YouTube at it's just my name, Philip Robb Jr., MD. And you can watch me do surgeries and procedures and hear what patients have to say. What about you, Christina? Where can we find info about you?
So everybody can find me on my Instagram handle at Faces by DRT. I'll be here again tomorrow live. I'm actually going to do a solo this time. It's going to be a Fun Fact Friday. Yeah, I don't have a guest this time, but it's going to be a Fun Fact Friday. All the fun facts about me. I might be doing like some dinner topics, questions that you can ask me, but I also have questions that are fun questions that I'm going to pick up from a pool to ask myself as well as the people who are joining in. So I hope everybody can join me then. But I do have this Instagram live going until we're out of quarantine or out of isolation, should we say it. So for the next month or so, I will still be doing this every weekday at 3:00 on my Instagram live. You can also find me at on my YouTube channel. It's at 8 Faces by DRT1, and I usually will post. If I can, I'll get a copy of what we've done in Instagram Live and I'll post it there as well so you can go back and watch it if you want. You can also find me on Twitter at Faces by DRT. And I used to have a Periscope. I don't do much Periscope anymore, but that's also at Faces by DRT. I also have a Facebook, Faces by DRT. And then my website, facesbydrt.com. So hopefully all those channels you can find me, and I'd love to have Dr. Robb Jr. back on. So I will find another time with him because he is much needed. It seems like this particular IG live session, we've had a lot of comments and a lot of interaction. So we'd love to have him back on. I'd love to have you back on.
Awesome.
You want to come on next week?
I'd love to. Well, I got to look at my schedule. I'm so super busy doing absolutely nothing. So yeah, I'd love to come back on. This was great. Yeah. And thank you to everybody who watched and asked questions. That was so super helpful. You guys were a big part of this. So
yeah.
Thank you.
All right.
Thank you.
Kat,
thanks for having me.
Enjoy your dinner. I know it's probably taking you away from your kids. They've been like, daddy, daddy.
You just got me out of bedtime, so thank you.
All right. Bye.
All right. Bye-bye. Thank you, everybody.
See you later.